This is Bernie Ayers, COM 181, informative speech on choking. And here is my audience. Almost everyone will experience a choking episode at some point. Are you ready to help in that moment? So, according to Science Daily, children ages 4 years and younger are more susceptible and have poorer outcomes of a choking event. Reason being is children tend to put everything into their mouths, from toys, candy, small objects, and we all know they put everything in their mouths. Their airway is a lot smaller than ours, so things that would normally not cause us to choke would cause them to choke. Parents should pay attention to all warning labels and watch for anything that has choking hazard label on it. In adults, it's far less common. It does occur. Typically it's from food, other factors being alcohol or dentures. So today we're going to talk about the anatomy of the airway, signs and symptoms of the airway, or of choking, and then ways to aid a choking victim should you run upon one. So the airway is comprised of the upper respiratory system and the lower respiratory system. The upper respiratory system has the nasal cavity, the mouth, teeth, tongue, the pharynx, which is the portion directly behind the tongue, the larynx, which is just below that, and then the lower respiratory system has the trachea, which is our windpipe, the esophagus, which is our food, and then the lungs. Here you see an example of the anatomy of the airway, this being the upper respiratory system, this being the lower respiratory system. One thing to note too is right here in the trachea anyway, there's what's called the epiglottis, which is a flap or an opening that closes as we eat and swallow so that food doesn't go into our lungs and cause an aspiration pneumonia. So we're going to look for signs and symptoms. You're out in a restaurant, you look over and you see someone who appears to be choking. They're probably going to have the universal sign, which is like this. They're going to have the inability to talk, difficulty breathing or noisy breathing, the inability to cough forcefully. Their skin, lips, and nails will turn blue, and then they will eventually lose consciousness due to no oxygen. So what do you do when you run upon someone who's choking? We're going to look at the techniques used in a conscious versus unconscious child and a conscious versus unconscious adult. First, you want to ask, are you okay? Second, may I assist you? Some people, believe it or not, don't want help. They would rather you leave them alone. Send someone to call 911 or you call yourself to get some help on the way. If they are conscious and a child, usually about 40 pounds and under, you can hold them. And you're going to take the child and kind of put their face right on your hand, lay them face down, feet up here, face down here, and you usually sitting would be preferred. That way you won't lose your balance and drop the child. But you're going to give them 5 back blows, pretty forceful, not enough to hurt them, and you're trying to get the air to just push it from the lungs to push the object out. If it doesn't come out, you're going to cuff them and then flip them over, and you're going to give 5 chest compressions like in CPR. And again, the idea being that the air in the lungs would actually compress down and force the object out. You're going to repeat those steps until help arrives. If the child goes unconscious, we're going to lay them down on the floor or a hard surface, and you're going to do chest compressions, basically. And in an unconscious person, you want to use the implied consent rule, and that meaning that the majority of all people would want help in that situation. So again, chest compressions on an unconscious person. If the object comes up to where you can view it, you can use a finger to swipe it out, but do not put your fingers in anyone's mouth if you can't see the object for fear of forcing it or lodging it even further. In a conscious adult, again, are you okay? May I assist you? Call 911 or send someone to call 911. You're going to have them sit or stand, lean forward, and give back blows. Pretty forceful, again, trying to dislodge the object. If that doesn't work, we're going to use the Heimlich. So you're going to stand behind them. You're going to use a fist hand, usually with your dominant hand, left hand if you're left-handed, right if you're right. Cover it with the other hand, and then you're going to go just below the bone of the chest, right here, just below it, and you're going to go in and up, 5 times, and hope that you dislodge the object. If that doesn't work, you just repeat the back blows, repeat the Heimlich until it comes out, or they go unconscious. Once again, if they go unconscious, don't just let them drop to the floor. Help them or lay them down to the floor. onto a hard surface. The implied consent rule, again, meaning that they would want help in most situations, and you're going to do chest compressions in hopes that you can dislodge the object until help arrives. So that's basically it for choking. I strongly encourage you to attend a basic CPR and first aid class for expert advice and opinions on this, and hopefully by hearing me today, you'll know what to do in the next time you run upon someone who's choking.